the traveling man. Hello, hello, how are you?
How are you?
Dr. Gulani, pleasure meeting you. How was your travel from Bahrain? Yes? Flights are okay? Fantastic. Take a seat, I'll see you guys shortly. Hey, how are you? Corey?
Good to see you. How are you, man?
Right, good to see you.
How's it going, man?
I'm that side.
That's my father, yeah.
Very nice. How are you coming in?
Yeah, man, it was a 14-hour drive yesterday, man. I'm so glad to see you, man.
Everybody's arriving on time?
I'm just super happy, man. You don't know how excited I am, man. It's so good to see you, man.
My pleasure. Take a seat. I'll see you guys soon, okay?
Thank you.
Corey, how are you?
Good, how are you doing?
Great to see you. How was your travel coming in?
Nice.
Yes? Wonderful. Excellent. I'll see you guys shortly, alright? Yeah. Wonderful. How are you?
Hey, how's it going?
Pleasure meeting you.
It's so great to meet you.
How was your travel?
It was a quick change in Atlanta, but it was great.
How many flights?
So 2 flights, Huntsville to Atlanta, and we landed and had about 20 minutes and got coffee and got
All of you are on time. Perfect. Everyone's landing on time. Take a seat. I'll see you shortly, alright?
Sounds good.
Lovely.
Thanks for seeing me.
Absolutely, my pleasure. Okay, great. Here we are. We just finished refracting, neutralized everything. So for doctor, this is a wonderful patient with very advanced keratoconus, has also had cross-linking elsewhere before coming here. And, I've just refracted him, finished neutralizing with my streak retinoscope, and now I will see how much he can read. Can you read that, please?
Yeah, SBN.
Come on.
ZCD KSROH CDZKV.
Super. And doctor, this is dilated. I've already checked his refraction, undilated. So this is very difficult. I'm trying to bring his full keratoconus into effect. Come on, pushing you.
RH, when I blink it makes it better. CSZ.
Wonderful. Come on, pushing you.
CZ, it is in GVK.
Come on.
RH.
Has he ever read that?
KSC, something like that. I'm not sure exactly.
Very good. And I'm also watching his voice, and you saw he read fantastic. And now dilated, he's still going pretty well. And I'm also listening to him, doctors. Not just the vision part, but also listening for his confidence. Read that backwards for me, sir. Go. I know it's difficult, dilated.
Yeah, so it's CSKHR.
First one again.
RHKSC.
Last one again.
The last letter. C. Is it an O?
Blink.
Oh, it's a G, right?
Now, doctors, let me take him to a line and do what I call my $1 million testing. Remember? Because these are keratoconus patients, very advanced. He's already cross-linked, which I don't like before keratoconus treatments. And he's traveled here today among patients from all over the world who are landing. And I'm going to do this as my $1 million test. Is it worth doing surgery? Cover your left eye for me. Read that line, please.
Okay.
Nothing? Quick. Give me a scale 1 to 10. Quick.
10.
Lovely. So he said 10 on 10, and that's why I'm going to say yes to proceeding with surgery. So we'll proceed with LaZrPlastique, correct his very high regular astigmatism, and bring him back to the most usable we can, even in an eye that is not 20/20 because perception is 20. 10 on 10. Anything you want to say? Sorry.
To be honest, I mean, I've been to a lot of places. Originally from Iraq, so I currently live in Ohio. I'm a student. So I did the cross-linking back in 2018. And then at that time, the doctor were just telling me that we can't do anything more about it, just wear contact lenses, and it was just not comfortable, even though I ordered one. And then I started researching, and I went back to Iraq. I've seen a couple doctors over there. They were not able to do anything. It was kind of, they just kind of, you know, gave me an answer where like, I was so hopeless. So I started like researching, you know, on YouTube. I found Dr. Gulani. It gave me a lot of hope. Like 2 years ago, I was 19, and he just told me to wait, you know, when he turned 21. And obviously, coronavirus came in, and then here we are. You know, I came down here to do my surgery, which we're doing on Thursday. And if it gets better, I'm coming back for my left eye.
My pleasure.
I have a really high hope, so.
Sure, sorry. All of you come here with hope, but what I try to teach doctors is also how to be honest and have high integrity, and of course, confidence in their work. So. The reason I'm saying yes to him, even though he's not 20/20 and very advanced cone with having been cross-linked, is that even though I don't like cross-linking before refractive surgery because it limits the way it can be corrected, at least he's cross-linked, and we told him to wait for 2 years before he could come to he's 21 now. And today you're part of the videos you keep seeing. And the fact that he gave 10 on 10 means my refraction is on par and he has capacity to see. So we need to fight for this young man. Great to see you. How was your travel?
All good. I just traveled from Bahrain to Istanbul, Istanbul to Miami, and then to Jacksonville over here. With the doctors in Bahrain, they did not give me much options. So that's the reason I'm traveling, basically. And they were not much confident in what they were doing. So that's why I'm traveling over here to you. And hoping that I will get a vision which is acceptable in order for me to work, to proceed in my rest of life, basically.
So we'll fight for you, absolutely. I mean, we've had a teleconference before you came here, and doctors who are watching his keratometry is over 70 diopters. You can see the flashes ring, the book striae, scars. He's already had cross-linking, which I don't like in patients unless they are fixed to a certain level. So he's now stuck with very high regular astigmatism, very high hyperopic irregular astigmatism, which makes it difficult to approach with LaZrPlastique. So we'll be planning a Corneoplastique principle here, right? And I'll see you again tomorrow. Recheck everything that I went through today with you, and get some rest. You must be jet lagged with 3 flights from Bahrain all the way.
For sure.
I'll see you
Thank you
tomorrow.
so much.
Okay?
Thank you.
Absolutely.